Understanding pulmonary arterial hypertension. For Mary, climbing up the stairs to her apartment feels like climbing Mount Everest. She is out of breath and tired. Sometimes her lips turn blue and she feels dizzy. She has finally found out why. Mary suffers from pulmonary arterial hypertension, or PAH, a chronic disease that affects the lungs and the heart. The lungs and the heart are connected by pulmonary arteries. They transport blood from the heart to the lungs so that it is enriched with oxygen again. In pulmonary arterial hypertension, the walls of these arteries get thicker. That process narrows the passage for the blood. Just like with a compressed garden hose, the blood flow is slower and the pressure rises. The heart tries to work against the increasing pressure. Due to the high amount of stress, the right side of the heart becomes larger and weaker over time. This is why patients like Mary get out of breath easily. To describe the medical condition and the severity of PAH, a PH healthcare professional assigns a patient to what's called a WHO functional class. That helps the healthcare team to better understand how PH is affecting the patient. In Functional Class 1, PH patients have no symptoms during ordinary activities or at rest. In Functional Class 2, patients are comfortable at rest, but ordinary activities such as climbing a flight of stairs, grocery shopping, or making the bed result in dyspnea or chest pain. In contrast, patients in Functional Class 3 may not have symptoms at rest, but any activity is greatly limited by shortness of breath, fatigue, or near fainting. Patients in this class have to take breaks while doing daily life activities. Patients in Functional Class 4 even have PH symptoms at rest, which increase with any kind of physical activity. Like anyone else, a PH patient has good and bad days. The functional class describes their overall condition independent of how they are doing on a particular day. For Mary, dealing with the diagnosis was tough at first, but she finds support in a PAH specialist. Together, they discuss how Mary can achieve a better functional class, resulting in an improved quality of life. She can take a single drug, or a combination of 2 or 3 different PH medications can help her to reach a higher functional class. Mary also receives excellent support in her patient organization. They provide her with a lot of information about the disease, help her to find a PH specialist near where she lives, put her in touch with experts if she wants psychological counseling, and give her a chance to exchange experiences with other patients. Knowledge is the first step. Talk to your PAH specialist and find out more at phaeurope.org.